Isang maganda at malusog na hapon po sa ating mga Kapihan viewers sa Facebook at sa YouTube, ganyan din sa ating mga media partners. Ako po si Nikki Nasasario, isang Juana mula sa Kagawaran ng Kalusugan, and welcome to today's Kapihan with Media. Bago po natin tuluyang umpisahan ang ating talakayan ngayong araw, narito lamang po muli ang ating mga house rules. To ensure the smooth flow of this session, everyone is encouraged to: number 1, use the naming convention below for Zoom usernames to ensure proper acknowledgement. Number 2, pay attention to the discussion of our health experts and or resource persons. Number 3, keep your microphones muted while speakers are discussing and presenting. And number 4, should you have questions, participants should signify and send them in the Zoom's chat box and wait for the host to acknowledge them. There shall be an open forum after the discussion. Submitted questions will be addressed first by our experts, followed by Zoom chat box questions. Every participant is advised to reserve questions. And again, only questions related to the topic discussed will be entertained. Join the meeting until the last part of the session. So, bagaman nagdaan na po ang World Suicide Prevention Day noong September 10, atin pa rin po itong ginugunita sa araw na ito. And to discuss to us the approach of the WHO to suicide prevention, we have with us today Dr. Jasmine Vergara, the Technical Officer for Mental Health and Substance Use at the World Health Organization, Philippines. Good afternoon, Doc Jazz.
Magandang hapon sa iyo, Nikki. Good afternoon sa lahat ng mga nanonood ng Kapihan session with Media today. Thank you.
And sige po, Doc, we'll flash your slides and then you may start your discussion na po.
Maraming salamat. For this presentation, on behalf of our WHO representative, Dr. Rui Paula de Jesus, nagpapasalamat kami sa Department of Health for this important session to share with you the Live Life, WHO's approach to suicide prevention. Next slide, please. So we know that suicide is a major public health problem, and more than 700,000 globally, people lose their life to suicide every year. Nakikita natin dito sa mga datos na the factors that contribute to suicide and its prevention are complex and not usually fully understood. Majority ng namamatay sa deaths na globally, 77% occur in low and middle income countries are with suicide. No? Beyond this, suicide has a ripple effect. Yung tinatawag natin na parang nag-ripple yung effect niya na i-impact ang ating mga societies, communities, friends, and families who have lost a loved one to suicide. There are indications that each person who dies of suicide, there are likely to be more than 20 others who attempt suicide. Sinasabi rin ng data natin na suicide is among the top 20 leading causes of death worldwide, and with more deaths due to suicide than example like malaria, breast cancer, war, or homicide. Globally, in every 100 deaths, more than 1 or 1.3% was by suicide, death by suicide in 2019. And tinitingnan natin and tinitrato natin that every suicide is a tragedy. Isang buhay ito, kapamilya, kamag-anak, kaibigan, katrabaho. No? Next slide, please. So, sino ang at risk natin? No? Who is at risk? While the link ng suicide between mental disorders and suicide, in particular depression and alcohol use disorders, a previous suicide attempt is well established sa mga high-income countries. Many suicide happens impulsively. Ito yung mga moment na meron tayong na-experience na crisis or a breakdown in the ability ng isang individual sa life stresses. Kasama nito mga factors on financial problems, relationship breakup, or chronic pain or illness. Marami rin ang mga potential risks. In addition to this is mga tao nakaka-experience ng conflict or disaster or violence, abuse or loss, and sense of isolation and strongly associated to suicidal behavior. Suicide rates are also high among vulnerable individuals who experience discrimination, such as yung mga refugees and migrants or indigenous peoples, or some people that may be experiencing from our LGBTI community and some mga prisoners. Next slide, please. I'd like to highlight that adolescents and young adults are highly vulnerable. In global data in 2019, suicide is the fourth leading cause of death among 15 to 29 years of age. No, ito yung mga bata, mga kabataan. Suicides among young people account for nearly a quarter of all suicides globally, and more than half of global suicides occur before the age of 50 years old. Sa data na nakikita natin, globally, more men die by suicide than women, but this difference is less pronounced in low and middle income countries. So tinitingnan din natin, depende on the context ng countries ang nakikita kung saan mas mataas ang suicide. Next slide. I'd like to emphasize here that suicidal behaviors are not easy to explain. Walang clear explanation or walang single factor, no? The factor that leads individuals to take their own life are multiple and complex. It can be, from health, kasama ng mga mental health, stressful life events, as I mentioned ko kanina, social and cultural factors need to be considered when trying to understand suicidal behavior, emphasizing that suicides are never the result of a single factor or event. Next slide, please. When we talk about data and data quality, globally, the availability and quality of data on suicide and suicide attempts are poor. May nakikita lang tayo only about 80 member states have good quality data, vital registration data that can be used directly to estimate suicide rates. If you can see on the screen, you can visit the Western Pacific Health Data Platform and look at how live data are captured. Some are poor quality data, and you can see that hindi masyadong nakakollect ang data on suicide attempts or self-harm globally. This problem of poor quality mortality data is not just hindi lang siya unique sa suicide, but given the sensitivity of suicide, it is likely that underreporting and misclassification are greater problems for suicide than most other causes of death. The improved in surveillance, yung tinatawag natin na pag-collect ng data and monitor of suicide and suicide attempts is required for effective suicide prevention strategies. Pag nakita natin data, mas mapapaigin natin yung mga efforts natin on the ground and how to address and prevent suicide. It can be in a cross-national differences in patterns of suicide and changes in the rates, matters or methods of suicide highlights the need for each country to improve the comprehensiveness and quality and timeliness of their data, suicide-related data. This includes in the form of registration of suicide in hospital-based registries or suicide attempts and nationally representative surveys. Pwede mga information, pwede rin manggagaling sa mga self-reported questionnaires or information. Next slide, please. Globally, suicide prevention is a priority. Now, reducing suicide is an indicator and is the only indicator ng mental health in the United Nations Sustainable Development Goals, or the SDGs. It is aimed at reducing suicide rates by 1/3 by 2030 in the SDGs. And in the WHO Mental Health Action Plan 2013 to 2030, WHO member states, kasama dito ang Philippines, have committed themselves to working towards the global target of reducing suicide rate in countries by 1/3 by 2030. I would like to emphasize that suicides are preventable. much can be done to prevent suicide at individual, community, and national levels. Next slide, please. Access to emotional support at the right time and restricting access to highly lethal means of suicide to buy time while dealing with suicide feelings can prevent suicidal feelings can prevent suicide. There are effective interventions that exist, and I'd like to share with you the WHO's Live Life approach. If you would see here, these are the key a package of effective and evidence-based multi-sectoral interventions for suicide prevention. Ang vision natin is makita ang world where death by suicide is no longer a leading cause of death, and where people who are attempting or thinking about suicide feel comfortable seeking help, which is provided capably and respectfully to all. The ultimate goal of WHO's Live Life is through its multi-sectoral implementation is the reduction of mortality of by suicide. So if makikita niyo dito, no, yung Live Life, there are cross-cutting foundations such as the situational analysis, multi-sectoral collaboration, awareness raising, capacity building, financing and surveillance, monitoring and evaluation. Meron tayong tinatawag na key effective evidence-based interventions na LIFE, no? L stands for limiting access to means of suicide. The I stands for interaction or interact with the media on responsible reporting. And F, fostering the skills or life skills of young people. And E, early identify and support everyone affected. So ito yung mga foundational pillars, and allow me to walk you through each of the LIFE, the life. Next slide, please. So starting with L, limit access to means of suicide. It can be from accessing harmful pesticides or firearms is the key universal intervention. Self-poisoning with pesticide cause up to about 1 in 5 of the world's suicides. And you can see on your screen, we have the resource from WHO and a resource for pesticide registrars and regulators, where they have a key role in prevention of suicide. There are appropriate mga regulatory actions na para mag-ban ng mga suicide specific pesticides that has the potential to save thousands of lives every year. Mga important approaches to pesticide registrars and regulators can take and are described in this resource guide or resource booklet natin. Next slide, please. So next slide, next intervention is from the L or the I tayo. The I stands for interact with media on responsible reporting. So as highlighted here, the media professionals should communicate stories of successful coping and of seeking and receiving help, but refrain from glamorized presentation of suicide and thereby avoiding the imitation. Kahapon or today, we have also released, WHO has released the Preventing Suicide, a resource for media professionals. This is the 4th edition of this resource guide. This is in collaboration with the International Association for Suicide Prevention, and sinasummarize dito yung current evidence on the impact of media reporting on suicide and provides practical guidance for media professionals such as the ones that we are having this session with on how to report on suicide responsibly. This updated WHO media resource also summarize the impact of suicide reporting and provides information for media professionals of how best to do this reporting. Ma-download nyo to sa aming website sa who.int, and this updated resource also covers the element and applies to new media such as in the online or digital platform or social media, as well as yung tinatawag nating traditional media such as print, broadcast, or radio or television. Next slide, please. Allow me to just briefly go through to this resource and highlight that there is overwhelming evidence that the media can play a significant role in either enhancing suicide prevention efforts or actually weakening them. For example, sinasabi sa research natin that evidence shows that vulnerable persons, such as those with a history of suicide attempts, or those who are, at high risk, are at an increased risk of engaging in imitative behaviors following media reports on suicide. This resource, as mentioned, offers guidance on how to ensure that reporting on suicide is accurate, responsible, and appropriate. This also highlights the increasing evidence that reporting focusing on survival and resilience can lead to positive imitative behavior that can contribute to suicide prevention. It also sets out guidelines on how to report, on stories on recovery, stories on hope, and on mental health and emotional well-being. Next slide, please. Some do's and don'ts that you can actually see on the screen, and actually part also of this guidelines or resources when we how to responsibly report on suicide is to provide accurate information about where and how to seek help. Do recognize that actually media professionals may be affected themselves when covering stories about suicide, and do apply particular caution on reporting celebrity suicides, as this can be also can cause imitative behaviors. And do educate the public with the facts. If you want to gather the facts and recent data, the materials that we have shared, we can use them. And report stories of how to cope with the life stressors, and actually how to manage and provide stories of hope and recovery. Do apply also caution when interviewing bereaved families, friends or colleagues who are actually a person who has lived experience on suicide. Next slide. On the don'ts, what to avoid when reporting on suicide. So these are just some don'ts. We don't use sensational language. We don't describe explicitly the methods used. We don't name actually or provide details about the site and location to provide privacy for the family or the people concerned. Don't report on the details of notes. Minsan nakikita natin yung mga reports left and right described explicitly, but these are irresponsible reporting on suicide. Don't oversimplify this reason for suicide or reduce to a singular factor. And as mentioned earlier, there are several factors that contribute to suicidal behaviors. We don't use photographs, videos, footages, or recordings, as well as don't use languages or content which sensationalize or romanticize or normalize suicide. We don't position suicide on highly top content on stories as well. Next slide, please. The Philippines, and we commend the Department of Health and its partners for its already has provided guidelines on the responsible reporting of a suicide on media and even portrayal on audiovisual and films. And the Department of Health also, in partnership with the WHO and the Australian government, this year conducted a series of what we call mindful media. It is a capacity building development sessions which aim to we have equipped at least 50 communicators, storytellers, and media support and monitoring groups with the skills and tools for responsible reporting of suicide in the country. So we call this as a mindful media session, which focus on the central principles of ethical reporting. This includes respect, promoting and respecting life, responsibility, preventing further harm, and care, promoting healing and support for sources and audiences, practitioners, and organizations. Next slide, please. On the F, the F on the life is what we call on foster life skills of young people. So from WHO and UNICEF, we have this suicide prevention toolkit or guidance or guidelines, which we call Helping Adolescents Thrive, or HAT, H-A-T. And it has its cost-effective interventions. It has a menu of cost-effective interventions for mental health, recommends implementation covering social emotional life skills training. It covers also mental health awareness training, mental health literacy, skills training, possibly problem solving sa mga bata or sa mga kabataan natin, how to cope with stress, may it be in school or in the community with your friends. Rather than focusing explicitly on suicide, it is recommended that the programs employ a positive mental health approach. How do we promote mental health in the overall work, especially in providing nurturing and safe environment. So this Helping Adolescents Thrive also covers areas of developing and enforcing policies and laws, support for caregivers to provide nurturing care and environment, how to implement school-based programs and improve communities and digital environments. This year also, late last year and early this year, February, Department of Health with the Department of Education, supported also by WHO and the Australian government, conducting pre-testing modules for suicide prevention in schools. We conducted this among school personnel. May mga 16 teachers kami na nakasama doon, mga guidance designates, principals, guidance counselors, administrative assistants, and child protection committee member, and even a nurse or health professionals. Na-conduct namin yung 3-day pre-testing workshop. And yung module na yun, yung nakikita nyo yung basics of suicide prevention, retest natin, kasama doon yung active listening, mga principles of communication, assessment of the risk, or safety planning, or in-assess din natin yung kapasidad ng mga school personnel. O paano kaya yung modules or how to design own suicide prevention or crisis response in protocols in schools. So as emphasized, suicide prevention is a shared responsibility between different stakeholders, and in this lens, the Department of Health and the Department of Education has been initiating this work, and more work has been forthcoming to also strengthen this lens. Next slide, please. On the E, sa life, this is where you have the early identification, management, and follow-up. This is where the healthcare systems needs to increase or incorporate suicide prevention work as a core component and train healthcare workers or community health workers, identify, assess, manage, and follow up those who attempted suicide or at risk. Universal health coverage needs to be to ensure that all people can access care. Ang WHO has this WHO Mental Health Gap Action Program, nakikita sa screen there, and suicide is one of the priority conditions in that module, which was launched back in 2008. It provides evidence-based technical guidance to scale up services on provision and care on mental, neurological, and substance use disorder. And under the current WHO Special Initiative for Mental Health, which we are partnering closely with the Department of Health, a series of Mental Health Gap Action Program Intervention Guide, or MHGAP IG, covering depression, psychosis, epilepsy, as well as self-harm or modules on suicide. Capacity building efforts have been conducted. It is siguro na makikita natin ang mga personnel na na-reach na natin under this initiative is more than 2,500 healthcare workers na ang na-train natin on MHCAP, and Department of Health has been accrediting almost 362 medication access program on mental health that are able to provide relevant medications of about 27 mental health medicines for those who need it. Ang aim din natin ng MHCAP is to train non-specialists. If you could see the screen, these are non-specialists or primary care physicians or personnel, or even tinitrain na rin natin ang mga community-based mental health workers under the community-based mental health program, or providing also capacity building work under the mental health and psychosocial support of how they can provide, practical support for those who may need at the height of crisis, offering practical or referring them to appropriate services when they actually need them, and then referring them to specialists for any complex cases. Next slide, please. So the Live Life, as mentioned earlier on cross-cutting foundation, covers different intervention and should be synergistically aligned with each other. And on multi-sectoral collaboration currently, or even for the past years, on the implementation of the Mental Health Act, the Philippine Council for Mental Health Strategic Plan covers the promotion of mental health and the prevention of suicide and mental health disorders will be an area of focus over the next 5 years. Yung magagawin pa natin next strategy. On the lens of surveillance, monitoring, and evaluation, the Department of Health, actually also with support from WHO, had developed a registry or self-harm registry, and was piloted initially in 2021 and then followed by 2022, 2023, initially to 3 hospitals, and then expanding to about 18 hospitals, where establishing and maintaining a suicide surveillance system for suicide attempts and self-harm was conducted. So during this time, we had about 3 hospitals, two in the capital, 1 in the provincial back in 2021. Then 18 hospitals across the country in 2023 have been trained and given credentials to encode in the registry by the Parenting platform na tinatawag during that time. And we were able to gather some clear data and on suicide attempts and self-harm, which would be useful for the different hospitals and locations for them to strengthen their suicide prevention strategies. Next slide, please. So as highlighted also earlier, access to emotional support at the right time and restricting access to highly lethal means of suicide to buy time while dealing with suicidal feelings can prevent suicide. I would like to emphasize some clear guidance and facts on this. And it is okay to talk openly about suicide. We can offer help if we'd be able to, and encourage help seeking for others who may be at risk. If someone is speaking about suicidal thoughts, we take them seriously and have an open mind and offer our support. If this is something that is beyond our capacity, we can encourage them to seek professional help. We learn about potential warning signs and look out for them, and while suicidal thoughts may return, they may not be permanent. As mentioned earlier, suicidal behaviors are not easy to explain and never the result of a single factor or event. And learning about potential warning signs and to look out for them may be potential ways of preventing suicide and saving lives. Next slide. This year and for the past years, creating hope through action is the triennial theme of the World Suicide Prevention Day from 2021 to 2023, which is being observed on September 10, and we are also observing today. This theme serves as a powerful call for action and reminder that there is an alternative, ways to suicide, and that through our actions, we encourage hope and strengthen the prevention. By creating hope through action, we can signal to people experiencing suicidal thoughts that there is hope, and we care and we want to support them. It also suggests that our actions, no matter how big or small, may provide hope to those who are struggling. Lastly, it serves as a reminder that suicide prevention is a public health priority and urgent action is required to make sure suicide mortality rates are reduced. WHO will continue to work with the Department of Health and its key partners in moving and also supporting the 8-point agenda of the Secretary of Health, Dr. Ted Herbosa, and the Department of Health, specifically on point 6 of the 8-point agenda of the ginhawa ng isip at damdamin dahil ang bawat buhay ay mahalaga. Maraming salamat sa inyo, and over to you, Nikki.
Ayan. So maraming salamat po, Doc Jazz, na ipakita sa atin ni Doc Jazz kung ano-ano ang mga ginagawang inisyatibo ng World Health Organization para sa prevention ng suicide. Gayon ding panawagan po natin sa ating mga kasabang media partners ngayon ang call to action ng ating WHO at ang kagawaran para sa responsible reporting ng suicide. So muli makakasama po natin si Doc Jazz later sa ating Q&A portion mamaya pagkatapos ng presentation po natin. Maraming salamat, Doc Jazz. At upang talakayin naman sa atin ang suicide education, prevention strategies, and mental wellness promotion, makakasama natin si Dr. Bernard Argamosa, ang Program Director ng Crisis Hotline and Center for Wellness of the National Center for Mental Health. Good afternoon, Doc Bernard.
Yes, good afternoon at isang gumiginhawang araw po sa ating lahat.
Ayan. Sige po, Doc, you may start your presentation na po.
Sige po, tignan ko muna. Sorry. Can you see the slides na?
Yes po, Doc.
Yan.
Doc, I believe naka-mute po sila and naka-off po yung camera.
Ayan, sorry. Sige, magandang hapon po ulit.
Ayan.
Ako po si Dr. Bernard Argamosa, and before I continue po, nagpapasalamat po kami sa Department of Health, sa ating friends from the media, at sa lahat po na nakikinig ngayon for inviting us again. I think 2021 yung last na na-invite kami. Hindi ko na alam kung last year kami na-invite. And I'm here to talk about kung ano po yung pinagkakabisihan namin sa National Center for Mental Health. Ang presentation po is entitled Kumusta Ka Tara? Usap tayo ang pagpapatuloy ng kwento tungo sa isang malusog na pambansang kaisipan. Ang objectives po ng presentation today is, of course, I'll be explaining the crisis hotline. Bakit ito nagkaroon? Ano po yung ginagawa namin? Ano po yung importance ng strategies namin pagdating po sa mental health? And how do we go forward from here? Kasi po, kung makikita po ninyo, ang crisis hotline po of the NCMH is mandated by law. Nakalagay po ito sa batas, na kailangan magtayo ang gobyerno ng crisis hotlines, palakasin ang mga existing hotlines, at expand po ito kasama po ang research and other interventions. Noong 2019 po, pasensya na po, wala pong model. Nilaunch po ang crisis hotline namin with the aim of stabilizing and referring clients to mental health professionals, especially those who are in crisis, including suicide. Nakakatuwa po no, na from 2019 to 2023, these are the number of service users we have serviced. This is as of March 31, 2023. And year in, year out, 31%, at least 30% po ng mga tumatawag are suicide related. Meron pong suicidality related po ang kanilang mga tawag. And nakakatuwa po kasi marami pong tumatawag. Grabe po ang increase, especially during the pandemic. No? Sabi nga namin, nakatulong ng malaki ang crisis hotline kasi noong mga panahong nagsara ang mundo, kami po hindi. Okay? And those suicide-related calls, around 18,000, called with concerns regarding thoughts of suicide and suicide-related behaviors. Yung age range po, in general po yan, more on the 18 to 31. Pero ang nakakagulat po rito, yung maraming minors na tumatawag, especially yung mga, sabihin natin, middle teens. No? And by sex, mas marami po yung babae, pero nakita po namin yung trend, dumadami na rin po yung mga lalaking tumatawag. Although marami pong NCR, no, marami rin po yung mga from Region 12, and ito po yung tina-target namin, yung mga regions na medyo mababa yung tawag. Later, I'll be discussing ano po yung mga initiatives para po maparami pa yung tumatawag. And these are the top 10 reasons for calling and satisfaction survey conducted. Doon po sa mga tumatawag, ito po yung breakdown. No? Hindi naman po lahat nakakausap lang. Iba po kasi kailangan talaga ng consultation dati ng pasyente na kailangan ng kanilang mga doktor kasi nga nawalan noon. Iba naman po ay kailangan mai-refer to other health professionals. No? Tumatawag din po sila. Ito po yung for the year 2023 as of August 31, naka 11,000 na po tayo na naservisyohan. Ano po yung mga nakita namin through the years na nag-ooperate ang crisis line? Marami pong issues na lumabas. So ang dami po pala talagang tao, kababayan natin, ang nangangailangan ng mental health intervention. Hindi lang po yung mga tinatawag nating psychotic, marami po yung mga anxiety, especially siguro dahil din sa pandemic. No? And then suicide, sabi nga ni Doc Jazz, is a very complex and hindi po siya simpleng problema na kailangan po ang continuous capacitation ng ating mga tao. Naging problema din po namin yung manpower issues kasi syempre hindi po madaling sumagot ng tawag, no? At nagkakaroon po ng tinatawag din nating mga burnout sa ating mga responders, and very complex po ang hotline. Mahirap pong kailangan ready ka lagi emotionally, physically to handle the calls. Timeliness of the referrals, saan mo siya dadalhin, naging problema ho yan ng pandemic. Actually, problema pa rin ho yan hanggang ngayon kasi nga po, very limited ang ating mga mental health professionals. Follow-up, monitoring, and reportorial systems. And pero ba ibang hotlines? Kami lang? Yung iba ba may bayad? Yung iba wala? No? And of course, the COVID-19 pandemic, nakita natin yung surge in the volume of calls. Marami pong minors. Ang problema po dito sa National Center for Mental Health, hindi lang po yung trabaho namin. Nagmumultitasking na po yung mga tao natin para lang po mapunan yung pagkukulang natin sa manpower. So, from being a portal of referral lang nung una, we decided kailangan holistic, pangmalakihan, pangmalakasan yung ating gagawing serbisyo. Not just psychoeducation, information dissemination, but also crisis intervention in general. And to address an individual state of crisis and helping them cope with their current situation. Iba po to bridge them to the next level of care sa higher professional. And we realize hindi po namin to kaya mag-isa. Na ang amin pong trabaho sa crisis line, dynamic, evolving, collaboration and partnership is the key. So talagang minobilize po namin ang buong ospital, psychiatrists, clinical psychologists, and guidance counselors. Initially kami po ang nagtao sa hotline. We decided din po na kailangan namin ng higher training Kaya we procured the help of Living Works Australia. And dito po pumasok yung aming Applied Suicide Intervention Skills Training or yung ASSIST, which is the gold standard for suicide first aid training, including yung safe talk workshops. So ito po yung unang mga tao namin na na-train, kasama po kami dyan. Ito po yung safe talk. Ano po ba yung safe talk? This is a suicide awareness for everyone, no? That will help to identify sino ba yung tao, mga tao na may thoughts of suicide, and to connect them, yung persons with thoughts of suicide, to suicide first aid resources. Ito po yung ginagamit ng ating mga crisis responders at nung ating mga professionals dito po sa NCMH. Medyo busy po kami no? Hindi po talaga namin kaya. So from the hospital, lumabas po kami, nakipag-partner po kami with the different professional organizations, mental health groups, kasi kailangan po yung tulungan. No? I'll be explaining later. Whole of country approach po yung kailangan. So ito po yung mga pictures lang. No? And aside from the crisis hotline, yung mga tumatawag sa amin, na-realize namin, hindi pwedeng isang usap lang eh. So lahat po ng may suicidal thoughts at tingin ng mga responders natin with the guidelines na kailangan ng makausap pa, prompted us to go with the telemental health response. Ano po ba ito? Ito po ay isang telemental health system ang tawag namin, no? Bitly na nire-refer po namin sa aming Bitly account, mag-register sila doon at makakausap sila within 24 hours ng another mental health professional just to see kamusta po sila. Ito po yung flow na hindi ko na-explain, medyo complicated siya. Pero ang ano po is from the crisis line, nire-refer po sa telemental. Kung kailangan pa rin talaga ng psychiatrist, doon po namin ire-refer sa pinakamalapit na psychiatrist sa locality nila or even sa National Center for Mental Health. Ito po yung mga nagpalista. Pag sabing book, nagpunta sila sa Bitly. Unfortunately, hindi po lahat nagpapakita pero makikita po ninyo accomplishment through the years. Siguro nakatulong din po na yung pandemic is nandiyan pa rin, no? Hindi na siya global health emergency kaya siguro medyo bumaba na rin yung mga nagpapabook. Also, the NCMH Crisis Hotline initiated po yung first nationwide meeting with the other government and non-government hotlines. It opened the doors for further collaboration among the hotlines nationwide. Nagulat po kami, no? Marami palang hotlines na nabuo nung pandemic. In fact, ito po yung meeting namin with them, nalaman namin na hindi lang pala kami. Kaya we were able to get the regional helplines. No? Kasi wala ito eh. Wala ito nung una. That's why after that meeting, we gave the list to the DOH. Kaya lang unfortunately ata marami na dito yung nagsara. Siguro nga dahil yung pandemic ay nag-subside na. But kailangan pa rin po na magkaroon ng maraming hotlines. Kasi this is not just preventive promotive eh. May intervention po dito kahit paano. And going forward, ito po yung plano. Continuous capacitation ng ating mga tao, certification, hindi po pwedeng kasi suicide, sabi ko nga, complicated, mahirap po na skill ito na matutunan yung suicide education, prevention, intervention. Kailangan po magkaroon ng mas maraming pag-aaral, trainings. And we also have to evaluate and improve our system. Sabi nga doon sa law, kailangan daw magtayo ng hotlines and strengthen the others. Tulungan silang mag-set up. Ito po ay sinagot na ng National Center for Mental Health. Sa pamamagitan po nung ang aming pong mga tao, karamihan po ay certified trainers na in assist and safe talk. No? And ang ginagawa po namin ngayon is capacitation and training. Share ko po itong mga pictures na to. We are in partnership with West Visayas. Tumulong po kami sa kanilang basic crisis hotline training, Caraga, Eastern Visayas. And aside from the crisis hotline, yung binanggit din po ni Doc Jazz kanina, yung mental health psychosocial support in the form of training when it comes to psychological first aid kasi ito po ang pwedeng gawin ng karamihan sa atin dahil konti nga ang mental health professionals with the proper training na binibigay din po ng NCMH, napakarami po naming requests, dami po naming partnerships na nagawa at patuloy na ginagawa in the form of mga memorandum of understanding. Now, pag nakita ninyo po, hindi lang po LGUs, even the military, Coast Guard, Air Force, PNP, AFP, tinitrain po natin. Also, partners din po kami ng DOH in taking care of the carers. In fact, marami po kaming request. For example, yung ginawa nila sa Sarangani, no? 205 participants. No? Lahat po to frontliners na siguro na-burnout na. No? Kailangan talagang magkaroon ng psychosocial processing. No? Caring for the carers po yung tawag namin doon. So some of the activities that we do. No? And we are excited in the next few months, magkakaroon po kami ng bagong number na hopefully will be the unified number na. Kasi napansin po namin yung 1553, yes, you can access this through the landline, pero marami po kasing may cellphone. So kung kayo po ay may Unli, uso naman po yun, yung Unli promo sa mga cellphone, whether with all the telcos, Smart Sun, etc., pwede pong na kaming makontak. Ila-launch po namin ito in the next few weeks. With the help of our cloud-based system, we will have an easier, faster, and more efficient access to the 1553 system. Aside from this innovation sa cellphone namin, sa crisis hotline, we are elevating the telemental system to include our overseas Filipinos through our Bagong Bayani Mental Health Initiative. Lahat po ng OFWs currently outside the Philippines, magpapalista lang po sila dun sa ating Bitly system at sila po ay matitignan ng mental health professional for free. Okay? We call it the BBM for Overseas Filipinos Initiative. We have started this with the OWA, kaya lang magkakaroon kasi syempre ng leadership change, and we will also launch this, I hope, together with the new number system namin in the next few weeks, okay? So I think that would be all. Tuloy po ang kwento. Kahit po anong mangyari, tapos na ang pandemya, tuloy po ang kwento ng National Center for Mental Health 24/7, Crisis Hotline, Wellness Center. Tara, usap tayo. Magandang hapon po sa ating lahat.
Ayan. So maraming salamat po, Doc Bernard. No? Naway napaalala po sa atin ni Doc Bernard at ng NCMH na lagi pong mayroong makikinig sa inyong mga pinagdadaanan. Naririyan po ang ating mga kaibigan, ang ating mga mahal sa buhay, at naririyan din po ang 24/7 NCMH crisis hotlines. So hindi na rin po natin patatagalin pa, magtutungo na rin po tayo sa ating mga katanungan at makakasama natin muli si Doc Jazz at syempre si Doc Bernard. So para po sa ating unang katanungan, para kay Doc Jazz, does WHO Philippines have collaborative efforts with national stakeholders to combat and prevent suicide in the country?
Yes or no? Yes. Definitely. Thank you, Nikki. No, actually, when the mental health law has been passed, and even before that, the mental health psychosocial support lens, which is a multi-sectoral effort, has been there in the Philippines, where WHO has been supporting, even in if you would see back in the time of Typhoon Haiyan. But with the context or focus on suicide prevention in the country, on the implementation of the Mental Health Act. Specifically, for the past years, we have supported the Philippine Council for Mental Health on the development of its strategy to work on specific area also on the establishment of this suicide prevention work na na-highlight ko kanina. And then on the ongoing work, dine-develop yung new strategy ng Philippine Council for Mental Health. As you know, the council is composed of led by the Department of Health Secretary, with some members from the Secretary ng Department of Education, Commission on Human Rights, Department of Labor and Employment, Commission on Higher Education, DILG, along with representatives from a representative from the academe, professionals, and NGO. A new strategy will be upcoming, and we will be launching this together with the Department of Health, of course, in October. Central to this work is on the promotion on mental health and the prevention, suicide prevention areas, alongside also increasing access to quality mental health care, expanding to the community. Na-mention natin kanina, no, yung work na sinusuportahan natin ang Department of Health and the media practitioners in the capacity building work on the mindful media session. So this is also, expanding the partnership with the media, especially in the media. Marami tayong na-meet doon. How they're also providing or getting or initiating some work to capacitate or personnel or staff. Meron din tayong work specific on na-highlight kanina yung sa suicide prevention schools or forming the young on social emotional learning. And this is something that we would be looking forward to how it can be further rolled out and strengthened. I think that would be just more of the collaborative work that the WHO has been supporting the Department of Health and partners in the suicide prevention work in the country. Thank you.
Ayan. So maraming salamat, Doc Chas. No? So nakita natin na napakaraming inisyatibo, hindi lamang ng WHO, kung hindi kasama pati ang iba pang national government agencies upang ma-prevent ang suicide sa ating bansa. So para naman po sa ating next question, this will be for Doc Bernard. If an individual knows someone who is having suicidal thoughts, how can they help that individual po? Doc, I believe nakamute po sila.
Sorry. Doon papasok yung importance of the suicide education training that we give. No? Using the safe talk. No? Importante po na you should be there to look for the invitations, mga changes, and nabanggit natin kanina, ask directly. Meron bang thoughts? Naiisip mo ba? And that is one of the best ways to handle somebody who is in crisis. You listening, a listening ear, non-judgmental. So maghahalo-halo na po, no? Yung mental health and psychosocial support umbrella in general, papasok yung psychological first aid, lalagyan natin ng specific na suicide intervention skills technique. Yun po ang makakatulong sa isang individual who is experiencing crisis, including suicide.
Ayan. So maraming salamat for that, Doc Bernard. Doc Chas, would you like to add something po sa sinabi ni Doc Bernard?
I believe Dr. Bernard already captured the essence of that support, no? Having that, at the right moment, na mababigyan natin emotional support, importante yan to save a life. Thank you.
Ayan. So maraming salamat, Doc Bernard and Doc Chas. No? So kailangan po natin i-highlight na kahit napakaliit na tulong ng pakikinig, no, nakatutulong siya sa ating mga kasamang nangangailangan. So para naman po sa ating next question for Doc Chas, does the WHO also recommend debriefing or therapy sessions for those who handle suicide attempts and or situations?
Thank you, Nikki. Siguro I would not want to label it as therapy session, but maybe some debriefing aspect or psychosocial support is important, Sabihin na natin example, these are media practitioners that are handling suicide attempts or, news stories. As na-mention nga natin kanina, we do recognize that, media professionals may themselves be affected when covering stories about suicide, and we recommend media organizations should have capacity or to ensure that necessary support such as the briefing opportunities or mentoring arrangements are in place for their personnel or staff. Just like any member in the society or general public, individual media professionals should be encouraged to seek help from relevant services, as the highlight naman ni Dr. Bernard, the different available services, if they are negatively affected in any way. And each organization or each, let's say, facility or company or where you are should consider regular or proactive training on how to report on suicide if this is in the media aspect, and how to ensure one's own well-being and mental health and well-being. Thank you.
Ayan. So maraming salamat, Doc, siya sa pagka-clarify sa amin ng mga dapat gawin ng ating mga individuals or ating mga experts na nag-handle ng ganitong mga situation. So for our next question, and this is for Doc Bernard naman po, no? How do we explain the instances of those who have had failed suicide attempts but eventually do it again po?
Definitely, kung naulit yun, ibig sabihin, hindi na proseso. Remember, an individual going into crisis, ibig sabihin yung kanyang mga defenses, coping styles, bumagsak lahat. No? Pwede kasing may tumulong or eventually on his own, kinaya niya, pero hindi nagkaroon ng resolution. Hindi nagkaroon ng recovery. And I always tell my clients, life will punch you in the face, pwedeng on a daily basis, no? Let us be aware of our capacity. Hindi po kailangang mag-isa. Hindi po kahinaang humingi ng tulong. Nandyan po ang tulong kung kailangan. No? So, ang tingin ko po, yung mga nababalik doon sa state na yon, hindi na-address yung main problem. Kaya po, for those nagkaroon na po ng suicide attempts in the past, professional help po kailangan. Hanapin po natin sila, doon po magsa-start, media, friends, employees, employers, managers. Hanapin natin sila and let's link them to a professional because definitely there is a bigger issue involved in suicide, lalo na yung nauulit. Yun po.
Maraming salamat for that, Doc Bernard. Doc Jazz, would you like to add something po sa sinabi po ni Doc Bernard? Ayan, so maraming salamat, Doc Bernard, no? So, ayan, yun nga po, bagaman magiging paulit-ulit pero malaking tulong na kung tayo mismo po ay nakaka-identify sa ating mga kasama, mga kaibigan na nakaranas ng ganitong experience, na tulungan natin silang mag-reach out or lumapit sa ating sa ating professional help. So para naman po sa next question, and this would be for Doc Jazz. What future initiatives is the WHO looking forward to or are currently in development to further suicide prevention programs?
Thank you, Nikki, and for the participant who asked that question. We do recognize, now we at WHO recognize that the work that needs to be done to reduce the number of people who die by suicide is still a lot. And express naman natin earlier about the live life approach, which WHO recommend to emphasize, and maybe this is the one that we need to scale up, yung 4 key interventions or yung evidence-based interventions na tinatawag natin, such as limiting access to means, no, interacting with the media on responsible media reporting, maybe that the modules that we have created and supported the Department of Health and our media partners to scale it up. Palawakin natin at bigyan ng mga kapasidad ang ating mga media practitioners, storytellers, communicators of how to responsibly, report on suicide. Then fostering life skills for young people. How do we how we can also further our support to the Department of Health and the Department of Education in this lens, especially in implementing that helping adolescents thrive work that we have earlier mentioned, and early identification support to everyone. So continue pa tayo nila Dr. Bernard and the National Center for Mental Health team and other partners in scaling up how we can capacitate our healthcare workers or even the community workers to help, maybe identify red flags, provide that immediate psychosocial support, practical support, and offer them to, reach the right services for them. This approach, together with our collective efforts towards improving the lives of Filipinas, will also enable us to protect people, who find themselves in severe distress and are at risk of suicide. Thank you.
Ayan. So maraming salamat for that, Doc Chas. Especially siguro para sa ating mga people, like sa normal people na nagwa-watch ngayon, napaka-importante na ma-take note natin yung live life na pinopromote ng ating WHO upang makatulong sa mga possible nating kakilalang may thoughts of suicide. So para naman po sa ating next question, this is for Doc Bernard and also maybe for Doc Jazz. What is the first set of actions that we should take if we see signs of withdrawal, of depressive behavior, and or suicidal thoughts in a person? Aside from the mentioned, meron pa po bang ibang mga sintomas na kinakailangang bantayan? Doc Bernard and then Doc Jazz po to answer.
Yes, yun po yung, again, babanggitin ko po, no? These are the, in mental health and psychosocial support, including suicide intervention, look, listen, link. Yun po yung basic. Ano yung look? Empleyado o employee mo, dati pumapasok to on time, maayos sa sarili, okay ang kanyang pakikitungo sa ibang tao. Hindi na pumapasok, magulo ang damit, lasing, may hangover, papasok, lagi nakikipag-away sa clients, di ba? Nakita mo na. Those are the invitations. Those are the markers. Anong gagawin mo? Ask. Listen. Narinig mo. Problemado sa bahay, problemado sa pamilya, may medical condition, di ba? So, you look, you listen, alam mo na yung problema. You give emotional support, yes, pero alam mo, kulang ako. Anong next? Link. Link them to a higher level of mental health care professional. Halika, usap tayo. Meron akong kilala dito. Meron dito. Diba? So yun yung basic ng psychological first aid. Look, listen, link. At yun po ang pwede nating magawa. Hindi po kailangan maging professional. Kailangan lang po proper training. Doon po papasok. Banggitin ko lang yung tanong kanina kasi education. You have to educate everybody. Kasi kahit mga doctors, minsan nakakalimutan nila na doktor ako Pag nagsalita ako, authoritative. Hindi nila alam, di ba? Yung pagsabi mo lang, for example, magain pa mo, infected ka, putulin na natin yan kaysa kumalat pa yung sakit mo, di ba? Maging septic ka pa. Kung ganun yung pagkakasabi sa yung doktor mo, parang ayaw mo na magpa-opera. Right? Di ba? Walang care, walang PFA-ish na dating. Pero kung ipapaliwanag sa'yo ng doktor in a PFA style, gaganda yung pakiramdam mo. Yes, malulungkot ka, pero syempre mas lalakas yung loob mo pumunta sa operating table, sa operating room. So, yun po, look, listen, and link. And doon po papasok lahat ng yung makakatulong po pagdating sa uplifting one's mental health.
Ayan. So maraming salamat for that, Doc Bernard. Doc Jazz, would you like to add something po sa sinabi ni Doc Bernard?
Thank you, Nikki. Thank you, Dr. Bernard. To follow through lang and emphasize that what Dr. Bernard mentioned also earlier. Kung tayo ay nakakaramdam ng kalungkutan at we think, that disturbing thoughts sa atin, it's okay to ask help, no? And then kung tayo naman ay nakakakita ng mga tao na potential sa risk on suicide, pwede tayo magtanong, no? Huwag tayo magtakot magtanong. Sabi ng iba, naisip nila baka raw pag nagtanong sa'yo, at nagtanong ka sa taong having suicidal thoughts, baka raw diretso sila ng suicide attempts and all. But in fact, pag tinanong mo ang taong who's having suicidal ideation or thoughts, minsan nakakagaan ito sa kanila, yung ambivalence nila sa pagpatuloy ng buhay nila, makakagaan sa kanila at makakatulong sa kanilang recovery. Yung sinabi nga ni Dr. Bernard, listen with an open mind, non-judgmental, buksan natin ang isip, pakinggan sila. And then we offer our support. Encourage them to seek the right help for them. And kung sakali naman na nasa immediate danger sila, wag natin sila iwanan. We can connect them to the right services. Tawag tayo sa NCMH crisis hotline paano maka-reach ng proper services. And then kung naman naka-reach out sila sa iyo a couple of days, pwede mo silang balikan. Kamustahin mo sila, no? Check in on them regularly, how they are doing, how they're moving on, and how they're recovering, no? Iba-iba ang meaning ng recovery sa isang individual, so iba-iba rin yung kapasidad natin sa pag-recover. Thank you.
Ayan. So, muli maraming salamat, Doc Bernard and Doc Jazz, no? So, talagang kahit kahit napakaliit na bagay ng pakikinig at ng pag-observe sa ating mga kasama, no? Maaaring maging napakalaking tulong nito, especially sa mga nakikitaan nga natin ng signs or possible attempts ng suicide. So, para po sa ating last question for today, and this is for Doc Bernard, no? For our general audience over Facebook and YouTube, what are the services that they can avail sa ating bansa to help them or someone they know prevent suicide?
Okay. I can only speak on behalf of the National Center for Mental Health. No, we are open 24/7. We have an emergency room for those who are in mental health crisis, not just suicide. May mga psychotic breakdown. No? Open po kami. We have an outpatient Monday to Friday catering to all for free. Okay? Wala pong bayad yan. Free medications. Punta lang po dito at tutulungan po namin. But definitely, we cannot do it alone. That is why we have our community-based mental health program. Nabanggit po ni Doc Jazz kanina, yung Mental Health Gap Action Program. I'm calling all the LGUs, all provincial hospitals, lahat po ng rural health units. Hindi po kasi marami napaka-konti ng psychiatrists, napaka-konti ng psychologists. But we have doctors. And we have the Mental Health Gap Action Program na ite-train po kayo to evaluate, assess, and treat basic mental health conditions. Libre po yan. Sulat lang po kayo dito sa National Center for Mental Health. Marami hong nag-immersion na dito, nagte-training. If you want to build or establish your own crisis hotline, sulat lang po kayo rito. We will give you the capacitation and training. Kung gusto po ninyong magtayo ng psych emergency or even psychiatric ward, as long as meron po kayong lugar, meron pong manpower, sulat din po kayo dito, libre ang training. Ikalat po natin yung kaalaman sa mental health kasi po, hindi na po pwedeng galing ka ng Samar, pupunta ka sa amin dito para magpa-check up. Napakahirap po nung ginagawa. Yun po ang nangyayari dati. Kaya overwhelmed ang ospital, hirap din po. Kaya hanggang ngayon po, the mental health state in the Philippines, I think, is still in its infantile stage. Marami pang nakatali, marami pang nakakulong, marami pa rin nung naniniwala na pag bilog ang buwan, susumpungin ka. No? So, lahat po ito, the stigma, the discrimination will be answered in time, continuous process of education, awareness, and training. Yun po yun.
Ayan. So maraming salamat for that, Doc Bernard. So muli po, bago po tayo tuluyang maghiwa-hiwalay sa araw po na ito, muli si Doc Jazz and then si Doc Bernard para po sa inyong takeaway messages sa ating mga tagapanood.
Thank you, Nikki, and maraming salamat sa lahat ng mga nanonood. Siguro ang plea ko lang for everyone is siguro kung may i-share man lang tayo sa ating social media platforms, online, sa ating mga kaibigan, we share stories of hope, stories of recovery, yung mga stories of survival. I myself also has experienced that, and ito yung aking gusto ko i-share. I'm a living example of, being saved by someone for accessing help and support. So with that also from WHO, as we do also recommend the live life approach, ulitin ko lang, limiting access to means of suicide, interacting with media on responsible reporting of suicide, fostering life success of the young people, and early identification and support to everyone. And this approach, together with our collective efforts towards improving the lives of Filipinos, we will be being able to protect people who find themselves in severe distress and are at risk of suicide. Thank you.
Ayan. So maraming salamat, Doc Jazz. Doc Bernard, para po sa inyong mga pabaong mensahe.
Ayun po, sabi na namin lahat ni Doc Jazz. Sabi ko lang, patuloy ko lang sasabihin na tuloy po ang kwento with the help of DOH, siyempre. Kayo ang aming funding agency. Tuloy nyo lang po yung suporta sa amin. Huwag po kayong magsasawa. Kasi po, we are expanding. We are going out of the halls of the National Center for Mental Health. Hindi po kami, di ba, wala nang institutionalization eh. Program-based na po tayo. And may tulong po, pag kailangan, magsabi lang po, open po ang National Center for Mental Health. Collaborate. Let's collaborate. Let's partner. Ang dami na po naming engagements. Padamihin pa po natin. Yun po ang kailangan natin para po maisulong po natin. One nation, one DOH approach po tayo. Hindi po natin kaya ang problema ng mental health ng maghihiwa-hiwalay po, Wala pong pagalingan, walang ganit. Sama-sama at kailangan po natin 'yan. Just like what we are doing now with the country, with the leaders, with the NGOs, with the GOs and everybody. So, yun lang po, maraming salamat po and a pleasant day to everyone.
Ayan. So muli po maraming salamat, Doc Chas and Doc Bernard. So muli ating alalahanin ang Live Life ng WHO at ang Look, Listen, and Link. Maging bukas po ang ating mga isipan, ng ating mga tenga, at ang ating mga bisig sa ating mga kakilala at maaari po tayong makasagip ng buhay. At muli po naririyan ang ating 24/7 NCMH hotlines upang masigurong may makikinig sa atin anumang oras saan man sa bansa. So muli po mula noon hanggang ngayon, nagpapasalamat po ang Kagawaran ng Kalusugan sa ating mga katuwang sa media sa patuloy na pagiging katuwang sa pagpapalaganap ng tama at napapanahong impormasyong pangkalusugan. So muli po, isang huwana mula sa Kagawaran ng Kalusugan. Ako po si Nikki Nesasario. At maraming salamat po, Doc Jazz, WHO, and Doc Bernard at NCMH sa pagpapaunlak ng aming imbitasyon sa araw pong ito. At muli po, maraming salamat po at magsama-sama po tayo sa isang healthy plea.